Hi, Dr. Paul. There are lots of machines out there at the moment that apparently lift and tighten your skin. How does the Doublo differ from that?
The Doublo is the newest generation high-intensity focused ultrasound machine. It enables a doctor to apply the heat at different levels under the skin while protecting the topmost layer of the skin. So it's very safe. It enables us to be very precise in where we want to place the heat, and that enables us to achieve better lifting of the tissues. So that's what difference it is.
Doctor, but there are treatments like, for example, let's say therapy, which also uses ultrasound, and they say you can measure the depth of the skin and how to use it. Is this similar, or would you say this is an upgraded version or something?
Yes, with the therapy, it was called microfocus ultrasound with visualization. Doublo as well, they had visualization as well in the previous machine called Doublo S, but with the newer iteration, Doublo Gold, they did away with it because none of the clinicians ever used it, and actually it's excessive. No one uses it, and it wastes time when we actually have to use the ultrasound to visualize the tissues. So the fact that we only have 3 transducers, the 4.5, the 3, and the 1.5, so it sort of like limits us as to whether or not we really want to go and ultrasound and see what depth we are actually at. Because roughly, it's going to be roughly that depth, in most patients anyway.
Doctor, how soon do you think a person can see results, and also how many treatments would, say, a person with my sagging, how many treatments would I need? How soon could I see results?
Yes. So for example, for you have very mild laxity, and you would probably see results on the first treatment. First treatment with the heat applied at 3 levels under the skin at 4.5, 3, and 1.5 millimeters. What happens with the collagen is that it tightens up, and it becomes a tighter, compact bundle. So you see actually a tightening of the tissues under the skin. You actually feel that it's firmer, and you will see that actually cause a little bit of lifting. So you definitely will see an immediate effect. And as the collagen heals over time, and it regenerates, and elastic fibers as well regenerate. So this happens over 3 to 6 months. You will see an effect which is becoming more and more apparent over 6 months to 1 year. People have already started retreating the areas after 6 months, and I think that is possible. But I wouldn't retreat the same area before 6 months, because I don't think that's necessary.
In terms of price point, would you say that this is of the same price as, say, Altera or Thermage, or would this be more expensive because it's a new machine?
I think this will be a cheaper machine. The individual lines are cheaper than Altera. The cartridge itself has 10,000 lines, whereas compared to Thermage, they sell in around 900 passes or something like that. So and we can't really compare between Thermage, which is RF, monopolar RF, versus the HIFU Doublo Gold. I think we probably would be better comparing Doublo Gold versus Altera's, and Doublo Gold would be definitely cheaper than Altera. Plus, from anecdotal, from what people tell me, it is actually less painful than Altera.
Thank you so much, Doctor. That's fantastic. Hi, Doctor. I have a question about Doublo. So basically, prior to treatment, do I need to take maybe a painkiller or use numbing cream?
Okay, it all depends on a person's pain threshold. Some people's pain threshold is very low, and if that's the case, then a painkiller and a numbing cream will work. At the end of the day, it's all about having the person comfortable through the treatment. So it all depends on the patient's pain threshold.
So would you say after one treatment, I should see significant results and I won't need to repeat it until maybe a year later?
Like I said, if it was slight sagging, you will see significant results. But if you have severe sagging, you will see results. But all of us are very vain, right? Once we see results, right, we want more. So you'll definitely be back. But you will not wait for 1 year. You'll be back in 6 months.